This report, therefore, contains information which will help the government to provide targeted response and for sound formulation of strategies and policies necessary for developing interventions to cushion the households. The objectives of the survey include measurement of the impact of COVID-19 on health, labor market, transport costs, and housing. The survey is also aimed at assessing the awareness of COVID-19 and the appropriate protective measures. The data collection for the second wave was undertaken from 30th May to 6th June 2020. The survey is being implemented using computer-assisted telephone interviews approach, in which the interviews are conducted through telephone. Ladies and gentlemen, among the key findings of the report in the first wave of the survey includes on the economic activity. The survey results show that out of the population of aged 18 years and above that worked for at least 1 hour during the 7 days preceding the survey period, 55.9% were aged 35 to 64 years. On working status, almost half, about 48.5% of the working population were self-employed persons comprising of working employers and own workers, while 35% were paid employees. About 4 out of 10, which is about 41.1% males, were in paid employment, compared to about 3 out of 10, 27.9% of the females. The proportion of those absent from work due to COVID-19 related issues was 61.9%, up from 49.9% that was recorded in May 2020. Of those absent from work, 77.8% were not sure when they will return to work. On travel patterns and cost of transportation, overall, 26.4% of individuals aged 18 years and above reported that they had not changed their travel patterns as a result of the COVID-19 pandemic. Nearly 27% indicated that they travel less often, while a further 17.4% had traveled less often but with more difficulty. Further, about 16.8% of the individuals indicated that they were unable to travel at all. Regarding change in cost of travel, nationally, 59.2% of the respondents reported a change in their cost travel due to pandemic, with 91.3% of them reporting an increase. On the means of transport used, about 14% of respondents changed their main means of transport as a coping mechanism to counter the effects of the pandemic. Out of those who had changed their means of transport, 62.2% opted to walking, while 19.4% opted to use boda. Only 5.8% indicated use of private vehicles as their main means of transport. On payment of house rent, nationally, 31.6% of households reported having paid rent for May 2020 on time, while 37% indicated they were unable to pay on time. Further, about 30.9% of the households who usually paid rent on time were unable to pay for May 2020. For those whose payment date was not yet due, 8.3% indicated that they will pay on time. Majority, who constitute about 61% of the households that were unable to pay rent, cited reduced income or earnings as the main reason. The survey further revealed that only 0.7% of the households that were paying rent had received full waiver or relief from landlords. About a third of the households, constituting about 33%, had not put in place any coping mechanism to counter the effect of COVID-19 on their ability to pay rent. On health, the findings from the survey show that 18.2% of the households reported having at least one individual with a pre-existing medical condition. About 35% of the households indicated that they had members with high blood pressure or hypertension, while a further 19.1% and 15.0% reported having members with allergies and diabetes, respectively. On testing for COVID-19, over 88% of the population aged 18 years and above indicated that they will be willing to be tested if the chance arose. When asked what one had done to feel better and cope during the period of COVID-19 pandemic, 25.4% indicated that they had found solace in family and relatives, while 25.3% had resorted to prayers and worshiping. On food security, nationally, 78.1% of households reported that they had food stock. About 4 out of 5, which constitutes about 78.8% of the households, perceived that there was an increase in food commodity prices over the COVID-19 pandemic period. Generally, 77.6% of the households reported having no challenge in accessing a market or a grocery store to purchase food items. On knowledge of coronavirus among the population aged 18 years and above is almost universal at 99%. Nationally, 82.8% of these individuals received information on coronavirus through the radio, while 58.6% received information through television. The survey assessed awareness of various methods used to protect against coronavirus. The most widely known methods are washing hands and use of mask at 96% and 86.8% respectively. On the coping mechanism in education, nationally, 65.8% of the surveyed households reported to have at least one member who usually attend a learning institution. Self-learning at home was reported as the main coping mechanism used by majority, about 57.5% of these households. Notably, however, 17% of households with members who usually attend a learning institutions were not using any method to continue with the learning. On financial distress, to overcome the financial distress caused by the pandemic, majority, about 41.9% of the households had cut on financial spending on commodities they could do without, while 14.8% took a loan from a friend, relative, and neighbors. Notably, 36.7% did not take any measure to overcome the financial distress caused by COVID-19. Regarding household assistance and cash transfer remittances, the proportion of households that reported to have received cash transfers or remittances from family, relatives, or friends since the case of COVID-19 in the country stood at 18.4%. A higher proportion, constituting about 22.9% of female-headed households, received cash transfers or remittances from relatives or friends compared to 16.9% of male-headed households. Regarding servicing of loans, almost a quarter, constituting about 24.5% of population aged 18 years and above, who were servicing a loan had successfully renegotiated the loan repayments due to circumstances emanating from COVID-19. Regarding domestic violence and households' main cause of worry, overall, 23.6% of the respondents reported to have witnessed or had cases of domestic violence in their communities. On main causes for household worry, majority, constituting about 72.5% of the household, reported that they were concerned about COVID-19, while 21.6% of the household reported being mainly worried about lack of food.